first thing is that we need to talk the same language. And so when I'm talking to patients, if they want to talk to me about sativa or indica or, some fancy cutesy name, I stop them and then we talk about what are we really talking about, and explain to them, I want you to talk to me in terms of cannabinoids. If I ask you what you're taking, tell me what cannabinoids you're taking. And then the rest of it is understanding who that patient is. Are they a naive patient or are they an experienced patient? The ratio is simply comparing apples to oranges. How many apples do you have to oranges? And if I have a naive patient, talking about CBD to THC, that ratio, if I have a naive patient, then I'm going to start at a much higher ratio, like a 20-to-1 or a 10-to-1. Anything 4-to-1 or above, chances are, and this is, this is general, patients are not going to experience that THC that's in that product. If I have a patient that is more used to using THC, more experienced, then I can start at a 3-to-1 or a lower ratio. If I have a cancer patient, I'm going to start at a 2-to-1 or 1-to-1 ratio, even if they're naive. The trick is to teach them how to use their THC, the only intoxicating cannabinoid, so they don't have those adverse experiences. And we certainly have had the patients who have taken too much, and we have to tell them, look, it doesn't mean that you need to take a trip to the ER. It means that we need to give you something else to help mitigate those negative experiences, like add some CBD or add some terpenes to it, so that you mitigate. That is one of the main reasons we do talk about fully extracted oil. That's the plant. Everything that's in that plant is in that oil, because those different components sort of mitigate any negative experiences patients may have with that THC. So what we're seeing is ratios matter depending on whether you're naive or experienced. Milligram content matter depending on naivety or experience. But truly, how it works, once again, depends on that patient's endocannabinoid system. We'll find ourselves starting maybe with a higher CBD and slowly titrating up that THC. Once again, it does make a difference whether you're using a fully extracted oil, where you will get away with using less, versus an isolate like a pure CBD compound or a pure THC compound. That has a much, what you call a more bell-shaped curve when using that isolate. So it's really important to hit them right at their sweet spot so they're getting just what they need, because once you go past that sweet spot, you may get more symptoms or no relief whatsoever, or worsening symptoms. So we try to steer them toward a fully extracted oil. We try to start with a ratio that we know is safest for them, so they don't have the negative experiences. And we try to start at a dose that it's easily titratable for them to use and get up to their sweet point. So we call it the minimal effective dose, the minimal effective dose. That's the dose that's working for you, relieving your symptoms without side effects, without damaging any other thing in your body. That's the minimal effective dose.